Good morning. Welcome back to CMAC TV. This is Dr. Bill Christenberry at Caldwell Mill Animal Clinic. Wanted to talk with you briefly about heat stroke because we're in the midst of summer and it's hot, and pets are very susceptible to heat stroke. We see it a good bit during this time of the year. And so wanted to give you some pointers about that. Some of the breeds that are more susceptible, probably the brachycephalic breeds. What that means is the smush face breeds, like a Shih Tzu or a Cavalier King Charles Spaniel, Pekingese. They just don't have a lot of air exchange to help cool down the air, and their lung tissue is basically inadequate to help cool them down. And as you may know, dogs don't sweat, and that's the only way they have to cool themselves down is through their lungs and the vapor that they blow off. Like we sweat, but they don't sweat. The vapors that they blow off from their lungs is what helps to cool them down. So they don't have enough capacity to do that, and so they're very susceptible. Dark colored dogs, black labs, they absorb more heat. As most people know, that anything that's dark absorbs more heat, and so they get hotter quicker. And then dogs that are real active, that just don't know when to quit, they get outside and they take off and they play in and run in, and they just don't have the understanding or the judgment, hey, I gotta pace myself. And so those are the ones that can really get into trouble. And you know, you hear this all the time, but boy, I still see people at restaurants that leave their dogs in their cars. Just last week, walked in a restaurant and there was a dog sitting in the car and the window was rolled down. It was black interior, sitting in the sun. You know, and just because you roll the windows down doesn't mean the temperature doesn't climb in the car. So things like that to watch out for. But some things to do. The mortality rate goes way down with dogs if people will institute treatment before they get to the veterinarian. If you realize there's a problem, then if you'll go ahead and institute some simple treatment before you get here, that really helps to decrease the mortality rate in the pets that do have heat stroke. And the symptoms that you're looking for are brick red, bright red mucous membranes, the gums, injected whites of the eyes where you can see the blood vessels. They'll have a real tense look to their panting. Their mouth is really pulled back hard, almost into a grimace. And you'll hear what's called stertorous breath, which is where you hear the soft palate kind of sticking, popping as they breathe, because they're just breathing so hard to try to cool themselves down. But, and you might can tell that they're hot if you put your hand in their tummy or their ear where they don't have as much hair. You can tell that they're hotter than they normally are. Their temperature can get up to 105, 106. I've seen dogs even 107 and 108, and those are ones that probably won't make it. But the things that treatment that you would want to institute there is cooling them down, not with ice cold water, but cool or tepid water. If you have ice packs, you can put them in their inguinal area, in between their back legs, up under their armpits, around their neck. That can help. You can take alcohol swabs and put them in their foot pads. That will help to cool them down as well. And of course, if you're in the car, put them in front of the air conditioner and get them on into here to the veterinarian. And when we see them, we can put an IV in, run cool IV fluids, which will help internal temperature, bringing that down, and cool water baths. We don't put them in an ice bath. Dogs, they don't tolerate that well, and plus it keeps you from being able to monitor them as well. But those ice packs, like I talked about, under the armpits and in between the back legs, around the neck, that certainly helps too. So just be on the lookout for that. Be very aware, because sometimes it'll sneak up on you. And the sooner you institute treatment with heat stroke, the better their survival rate can be. But the ones that really are not brought in soon enough, their mortality rate can approach 50%. So just remember those things and watch out for heat stroke, and have a great summer. And we'll see you next time on CMAC TV.